Hello, 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 everybody. Everybody who is already tuning to this great show, the Go JB Health Show. Thank you once again. Thank you once again, all my queen, my king, my princess, everybody who likes your brother Go JB. Your brother is here again. Once again, we're gonna sit down here. We're gonna sit back, relax. If you have to grab some popcorn, if you have to call your friends to sit with you, just sit back and relax for a nice ride with your brother JB. Today, as you can tell, I promised you that I was gonna be bringing some great people in the show. Today, I have a great queen with me today, and guess who she is? She's a specialist in mental health. And today, I'm not gonna speak for her, but I'm gonna say hello, my queen, Vanetta. How you doing?
Hello, thank you for having me. I'm doing great. How are you?
I'm doing great. So again, Vanetta, please, I have a lot of people on this program. I've been telling them about you. I've been telling them that I'm going to bring you here. Actually, next, I'll bring Dr. Powell, who will be talking. He's the president of the Sickle Cell Foundation. But I told them I was going to bring you here to talk about mental health. So first of all, would you introduce yourself to my dear people?
Sure. Again, thank you for having me here. I am Vanetta Mwengela. I am a psychiatric mental health provider as well as a primary health care provider. But today I'm going to be talking about mental health. And I'm so glad that you've been talking about the mental health, again, because it's a topic that most people shy away from. And I'm so excited to be here and to use your platform to be able to raise awareness.
Well, thank you. Thank you very much. We are very pleased that you're here because, hey, we've been promising my people in a while, been telling them that you were coming, but hey, it hasn't happened, but I told them that it was going to happen. Hey, my friend Jerry, how you doing? My queen Modu. A lot of the people who are already here, the people who are already tapping on that screen, thank you for being here. My friend, Pirito, thank you for being here. So everybody who is already here, please help us share. Continue to tap on the screen. I really love every one of you guys. You guys know that very well. So let's go. Let's go. So first of all, Miss Mengela, would you tell us what mental health is? So a lot of the time people talking about this term mental health, and we know a lot of our people don't really know that what this term is all about. So what is mental health?
Thank you. Thank you for this question. It's a very important question because so many people don't really understand what this term means. And because of that, so many people are shying away from the topic because when they hear mental health, they just think it means crazy. It means something bad, and nobody wants to be associated with it. But today, I want to clear that air. Mental health is just simply a state of your emotional and just psychological and emotional well-being. So when we talk about mental health, just like when we say physical health, we don't think about sickness or diseases. We're thinking about that optimal state of physical well-being, right? For mental health, we're looking at the optimal state of your psychological and emotional health. So that's what it is. It's just that optimal state. So when we start looking at what the different mental or psychiatric mental health disorders are, that's a whole different ball game. But when we say mental health, we're just looking at that optimal state of psychological and emotional well-being.
Well, thank you. That was a very good explanation there. So, again, I'm sorry because this show here, I have a lot of my people, a lot of my queen who follows this show. Yes. I have to always take a minute to say, to give some love to my friend, Joanne Vessel, my queen, Joanne Vessel. Thank you for being here. My dear friend, Thendi, thank you for being here. Beverly Thomas, one of the most important queen on this platform. Nicole, I see you there, one of the supporter, one of the subscriber to this platform. I see you. Thank you for being here. I have my friend user 31 who just asked a question, feeling hip pain, did an x-ray on on it. It shows nothing, but still having pain. So what type of pain are you having? Did you hurt yourself? Now you had an X-ray. Are you taking anything? Did the doctor did give you anything? Because again, it's very hard for me to come here and tell you exactly what medications you should be taking. But one of the things I could advise you is recently, I think yesterday or the day before, I post some videos that talks about some natural actually food that could help with inflammation and things like that. So I would encourage you to do that. But ultimately, I think you probably need to go to your doctor, to your primary care, to see so they could do a face-to-face assessment to see what's going on. So please do that. But thank you for your question, my friend, my dear friend. Appreciate you. Joanne Vessel, you're very welcome. It's my pleasure. I just appreciate the support. So, so it's Jeremy. Okay, my friend Jerry, it's Jeremy instead. My friend Jeremy, how you doing, bro? Now we have Miss Mangela here, and again, she is professional mental health professional, licensed professional in mental health. And I know a lot of the time we touch on this. So what I would encourage you guys to do as well, if you have any questions, because I know the last time I talked about mental health, you guys flooded me with questions of what you need to know about mental health. Again, I have to thank everybody who's tapping on that screen. I appreciate y'all. So the thing is, if you guys have any question, she will be here. She'll be answering questions as well. But now we're gonna continue to ask her some of the few questions. Now, just so you know, guys, there's something that I talk about here a couple of times on this show. We talk about the mental health first aid. So mental health first aid apparently is something that is new, and actually, honestly, it was a little new to me too. But Veneta or Miss Mangela is one of the instructors that teaches this class. So, Miss Mangela, what is mental health first aid? What is that?
Okay, and thank you again for taking the time to tell your viewers about it prior to today. Mental health first aid is basically the equivalent of CPR. So mental health first aid is to mental health what CPR is to physical health. And I always use this analogy before I take a deep dive into what it is. That way you can start thinking in line of what CPR is. So CPR, we use it in physical health to know when somebody is in distress, what we can do to help them and to get professional help right away, right? And we all know the importance how CPR has been saving lives. However, there was nothing for mental health. And we had so many people who were going through difficulties in crisis and they didn't have any help. So that's how mental health first aid came about. So it is a training that teaches individuals how to identify, understand, and connect individuals with resources, okay, in the community. It could be a provider when they're going through a mental health challenge or a substance use challenge. It could be a crisis, and we all know it could be a matter of life and death when it comes to that, especially topics like suicide. All right. You could be that person that could save someone's life who is contemplating ending their life. And you could be that person that will connect that individual. Just like you would call 911, it's the same thing. You're connecting this individual with specialty care. All right. So it's very, very important. It is one of the certification programs that Barack Obama pushed. Actually, Michelle Obama is mental health first aid certified. All right. So we are really big on mental health. It originated in Australia in 2000, and the USA brought it here in 2008, and it's been here since. So I'm really, really passionate about it, and I'm so glad you're talking about it as well.
My friend Josephine. Josephine, how you doing? I'm glad to see you here. I guess you guys heard from the professional, from the instructor. You heard exactly what mental health first aid is. Because again, I was talking about it, but I didn't know much information. All I did is doing an introduction, but I wanted to bring her here so she could give us the true information that we needed about it, you know?
Go JB, help, go JB, go JB, go JB. Go, go JB help. Go JB. Go JB. Go JB. Go JB.
You who are sharing this live or who are tapping on the screen. So also the people who are becoming new followers of this platform. Again, this is a very good choice that you're making. I post at least 1 to 2 videos on this platform. If you look, I'm everywhere on all the social media platform. But also, this show here is. It's really educating a lot of people. Like I always say, in the past 2 months, close to 3 million people. Yeah. So it's only with the support of everybody, like Queen Josephine Brooks, Queen Carla. So thank you. Hi, my favorite. Well, y'all my favorite too. So thank you, Willie, guys. I appreciate that you guys are here. So now the next question will be, hello, my friend Thanley. I see you. How you doing? Everybody who is sharing or tapping, I appreciate every one of you. And the guys who are subscribers to this platform, again, guys, you know you could always become a subscriber to this platform by going on top of the page where it says subscribe or clicking on the gold star. That will make you a subscriber and you're going to become one of my friends on TikTok. But anyway, so you who are tapping, you who are sharing, just know that I appreciate you from the bottom of my very beautiful heart. Okay. My Queen Fear Mary in the house. Thank you for those beautiful gifts, the beautiful roses that you sent to us. Appreciate you. Now, the next question will be, how do we get certified for mental health first aid? So how do we go about this? I know for CPR, saying right here, I teach CPR classes, so people could go and schedule a class. But how do we go about getting a class for mental health first aid? So how do we go about this? I'm pretty sure many people would like to know. Again, guys, mental health first aid, this is what we're talking about today. It's just one thing that really we could, if you are familiar, I know a lot of my people here are medical professionals. So if you are familiar with CPR, it's pretty much a CPR for people who have mental health issues. So really, it's a class that you go, you take, you get the basic information of how you could support yourself mentally if you about to have a mental breakdown, or if you have a mental breakdown, you could support yourself, you could support your family, you could support people around you. Because guys, we did talk about this. I think a lot of the things that are happening in our society, and obviously when I heard about mental health first aid, I was very happy to hear that, because we have so many things happening in this society today where people are hurting a bunch of people, or people are hurting themselves. But you know, a lot of the time it's just because of the fact that we are not trained to support these people. So I think the best thing that make me like this idea of mental health first aid is the fact that it's helping me. It's giving me the tool that I could help other people from doing things to hurt themselves or doing hurting other people. So, Miss Mangala, how do I go about getting that class? How can somebody get this class?
Okay, so at this moment, the easiest way to get enrolled is just to contact me directly. Because when you contact me directly, it could be either on social media, on Facebook. I always post every class that is coming up. That way, we can you can reach me directly, and I can enroll you directly into the class. All I would need is your email address, and then we're gonna send you the invite to create your account. And then you can go ahead and also enroll. I'll enroll you in the class, and you do your pre-course work. Because now, mental health first aid, it is an 8-hour long certification. Now, because of the pandemic, we started doing it online. So there's a 2-hour pre-course work that you can do at your own time before the class. So you do 2 hours of pre-course work, and then we do a virtual class. So it's via Zoom. So you can be anywhere in the continental USA and be able to take the class. Unlike before the pandemic, where you had to actually show up at the physical location. So we do the blended. I'm really doing the blended classes now, where you do 2 hours of pre-course work, and then we do 6.5 hours of instructor-led class. So during this class, that's when you start learning a lot about mental health, a lot about what the skills will be. Just like with CPR, you have to come and you have to press on the chest of that mannequin to practice. You're going to learn how to practice. How deep is my compression? How deep are my rescue breaths? Am I doing it enough? Is it good enough to be able to inflate the lungs? Is it my compressions good enough to be able to push blood to circulate and keep all these vital organs, just flowing with oxygenated blood? So now when you come into the class, the instructor-led portion is where we practice our skills. If somebody is going through depression, anxiety, panic attack, if you meet somebody who is going through a panic attack, what would you do? What would you do? So that's the question. That's what you'll be learning. If somebody is attempting or contemplating suicide, what would you do? How do you learn to speak to them in a way that is non-judgmental? How do you even approach them? How do you assess? What are you looking for? So many times when we hear about somebody is contemplating suicide, which is rather unfortunate, we make light of it, but it is not something that we make light of. So what would you do in that situation? We know for CPR, if I find somebody who is on the ground, I check for responsiveness by checking the pulse. If the person is not waking up, are you okay? Are you okay? I know immediately to call help and start chest compressions, right? The only reason I know that is because I took a CPR class. The only reason I know what to do to even know that somebody is in distress is because I took a class. Had I not gotten certified, I probably would think the person is sleeping and then let's just go on with my day, right? But because I'm certified, I'm trained, I have a trained eye to notice that, to identify that something is going on, then I go about now applying the skills that I learned. So when you get enrolled, like I said, you can either contact me directly. You can also go to the Mental Health First Aid USA site. You see multiple classes, but to get to my class, you have to look for it. But the easiest way is to just come to me directly and I'll enroll you in a class. So I'm on social media, Facebook, most of the time, IG. I'm really on TikTok, but not as much. So that's the best way to get to me. So plan for 6.5 hours of instructor-led portion of the certification, and then the 2 hours pre-course work, you can do it at your own time, at your own pace at home before the actual class. It's mandatory, so you cannot even get access to the class if you don't do your pre-course work. So that's how you get a class or get signed in.
Thank you very, very, very much. The people, my dear friend, very special friend, Fendi, thank you. And Jeremy, one of the subscriber to this platform with the GoJB name tag. Thank you for earning that name tag. Thank you. So if you have any question for Miss Mangala, she is here and she is available to answer any questions for you. If you have any question, so please ask your question.
And I was going to add real quick that the certification will last for 3 years. So it's valid for 3 years once you get certified.
3 years of certification, huh? Of knowing how to determine what mental health problem somebody's going through, huh? That's amazing. Do you know that you have a lot of people around you? Huh? I know a lot of you are at work watching this. Look around your work. Don't you think a lot of people around you may be going through some issues, but do you know how to help them? This is why I recommend the mental health first aid. I was about to say CPR first aid, but hey, it's mental health first aid. So I recommend that because I have seen a lot, huh? I've seen a lot in my career, whether in the hospital, whether in the clinic, I've seen a lot, huh? And the news, I've seen a lot as well. Everybody who are tapping on the Go JB Health, thank you for being here, huh? Little side note, anybody eats walnuts?
I do.
You eat walnuts. Do you know why you eating walnuts? Why is walnuts good for you?
For the omega-3s.
Good
The
job,
healthy
good
fats
job.
for me.
And Modu say, yes, I eat walnuts. So Modu, Queen Modu, good job. Continue, huh? Because let me tell you, walnuts has that omega-3 that could help in a lot of stuff, right? Decrease your cholesterol, actually help you or decrease your risk of chronic diseases. If you just join, we encourage that you follow me so you know when I am live the next time, so you get that notification. So you know whenever your brother is live the next time. But also, if you haven't followed me on YouTube or on Instagram or on Twitter or on Facebook, please do that. Subscribe me on YouTube. I need to grow these platforms as well. Again, guys, you are the people that really I count on to help me to continue to grow this platform, continue to expand the education. You have been a very important part of me reaching those so many million of people in the past 2 months.
While we're waiting for questions, do you have any other questions for me?
My people, Miss Mangala want to answer some questions for you guys. Do you guys have any questions? You guys always ask me questions. Today, ask her some questions. Miss D, thank you for liking, for tapping. Miss D, I see you, huh? You thought I didn't see you. I see you, Queen D. Hey, how have you been? How have you been? How have you been? Thank you. I'm happy to see you in the house. And I'm very happy to see you tapping, huh? What are simple signs of mental health? Good question. From one of my dear supporter, Jeremy. Thank you for the question. And we'll hand it over to Miss Mangala. What are the simple signs of mental health crisis?
Okay, good. Because when I heard what are the simple signs of mental health, I thought that was the question. Then I was like, I probably have to do another explanation of what mental health is. So when you said crisis, then boom, that is it. So it depends on what kind of mental health crisis that this individual is going through. Let's say, for example, we're going to take the most common one that is prevailing in many places around the world, not just the US, depression. Okay. Depression, when somebody's going through depression, some of the signs that you can look for is this individual really, really changing as far as the normal activities that they used to do, things that they used to love, and you find this individual not just, into that activity anymore. For example, they used to love playing tennis or go fishing or reading, and now they don't find any interest, literally no interest at all in that activity. Somebody who is having difficulty sleeping or staying asleep. You could have a loved one at home. You could easily notice this because probably you're noticing that before they used to sleep easy. Now they can't go to sleep or fall asleep or stay asleep. And you're noticing those changes. Appetite. They used to eat enough or they used to eat. Now they don't want to eat, or they're eating way more than they used to. They used to eat healthy food. Now they just want to eat comfort food and a lot of it. So for the people who will be eating a lot, you see weight gain. For the people who are not eating at all, you see weight loss. All right. Some of the other signs would be...
Got you off. Latoya, Queen Latoya, how you doing? I see you. Queen Miss D, I'm sorry you had issue with COVID, and I'm sorry, Miss Mangala. This is I always have to give love to these people who love
I understand.
Me. That's how we run here.
Yes.
So yeah, that's really what we do here. So I get it difficult to sleep. So by the way, since you answering this, my Queen Latoya, he's saying if you have issue with trying to go to sleep, how do you manage this? So
okay. So again, difficulties falling asleep could mean so many things. But in line of depression, you're probably staying awake because you're very anxious about something. Whatever it is that you're getting depressed about could keep you awake. And again, the reason I'm sticking to depression is because, like I said, difficulties falling asleep could mean so many things. This is when you fall within the criteria of depression, we can treat you in that line. We can suggest management as far as regarding depression. But if it is induced by something else, for example, if you take coffee before you go to sleep.
I'm sorry. I have to cut this off for 1 minute because my Queen Kathy St. John's, who just showed up and start giving us all these beautiful roses, those freshly picked roses. Thank you for your gift. I appreciate you, my queen. I appreciate you very, very much. Yes, I appreciate you. Go ahead.
All right. So then I was trying to answer some of the signs that you see: lack of sleep, that's depression. When we look at suicide, when you see somebody telling you that, don't worry about me, I won't be around much longer, or I won't be a bother anymore, or you see someone just cleaning up and donating most of their stuff, giving it away, or you see somebody who didn't even have a will and now all they want to talk about is get your will together, and you see somebody saying that, don't worry, I won't be around. Those are the signs that you want to know, you want to dig in. So some signs will be early signs. Some of the signs are just mild and moderate, and and some are really late signs or crisis mode. So we want to catch these things at the early stages, because when we prevent something at the stage where it's just beginning, the hope of recovery the chances are way higher than when we wait when it's a crisis mode. So I want to catch somebody who is contemplating suicide just when they start thinking about it versus when they're actually standing over a bridge and just getting ready to jump, because there's a likelihood that I might not catch them. But if I see it before that, I can apply a bunch of the skills that you can learn from getting certified and how to handle that. Because with mental health, the language is different. Prior to me starting getting certified as a mental health care provider, can you imagine that I didn't even know that using the word commit suicide is not appropriate? It is stigmatizing, it is judgmental, and we want to avoid certain things, especially when you say mental health issues. It's also a little bit stigmatizing. So we say challenges or difficulties, because when we say issue, have you heard when we attribute issues to, oh, you got issues, man? You know what I mean? It's kind of stigmatizing and judgmental. when you get certified, you learn how to use non-judgmental language. You learn how to listen non-judgmentally, meaning that I'm not trying to judge you. When we say commit, we commit a murder, commit an abortion. All those things have negative connotations to it. So with mental health, we try to stay away from language that is judgmental, and those are the kinds of skills that you will learn. I personally, I'm also learning not to say commit suicide. So it is no longer appropriate. It sounds very stigmatizing when you say, oh, this person committed suicide. It's like they just got up and did this thing, but because of what they were going through, we always say they died by suicide. So it's a little bit, we're not judging them, we're just saying that they died by suicide. So those are those are some of the things. So we could go on and on. For a panic attack, somebody will say, oh, I have difficulties breathing. They could feel like they have this heavy thing on their chest, and it could mean two things. It could mean just the panic attack, or it could mean a heart attack. So when you're trained, you know how to now ask this individual, have you had this before? And then they'll tell you, yeah, I have anxiety from time to time. And then they can tell you what they typically do. You can help them suggest certain things like deep breathing. Let's breathe together so we can calm you down. And again, if you cannot handle this, we always will have you recommend to bring in a professional. And that's when you dig into your resources that you will learn in the training, and or call 911. So we have a lot of other situations that I could tell you how to know when somebody's in crisis and what to do. But again, remember, this certification is 6 hours long, and I don't think we have that much time here to touch everything. But I hope that helped or answered your question. And for the young lady with the sleep deprivation, we could dig in further. It could mean so many other things, but if it is related to mental health or depression specifically, then that's when we look at it from the way of the certification process and what you can do. Sleep hygiene is one of them. Basically just making sure that your environment, the lighting is very, very conducive for sleep. Typically when it's off, not having a TV screen in your room. Keep away your phones. Don't look at your phone just 30 minutes before you want to go to bed. You want to stay away from all the electronics before bedtime. The color of your room, where your bed is located, that has to get into feng shui and all of that, but it also helps your sleep. So those are things that you can get into just to help yourself get some sleep. And then the temperature in the room also matters. So those little things, you can tweak them. I always try the non-medical route before, if you can really sleep and you really need to get to sleep, because we all need sleep to function, then we can get you medication from a professional. Like Go Be Health here, JB Health. You can reach out to get consultation as far as sleep aid. But again, that is like the last resort of the things you would do.
Thank you. A few more people asking a few more questions. But again, thank you to everybody who is currently watching, the people who've been sharing this great show. Again, my name is JB. This show is called Go JB Health, Go JB Health, where we talk about healthcare. So the next question, my dear friend, my Queen Thendi, is asking how to get healed emotionally. And followed is my friend here. And by the way, my friend, there's a friend here who asked about injection, having some issue. They had an injection, and now they can get pregnant and everything. I suggest that you go to your GYN, and they could do some more testing to determine exactly the reason why you can get pregnant. So, that would be my suggestion for you. Please, again, where I'm here, I wish I could fix everything right here behind the screen here. But unfortunately, it's not something that is so easy for me to do, because I want to keep you safe. Remember, the purpose of this is keeping you safe. So I don't want to tell you something to hurt you, right? But in the meantime, we could go with this. I have my queen, Miss D, who also asked, how do I get my immune system better? By the way, I'm going to let Miss Mangala to answer those questions, but I do have a couple of videos out there on my platform that could also help you with that. After you heard what her answers, go and watch those videos. I have a few food items, things that you don't have to pay pay, things that you may have around your house, things that you could buy through the store that I have that you could possibly use to take care of that. But anyway, I'm gonna let you go with the answers. How can you heal yourself emotionally? And then what's the best thing you could do to keep your immune system strong?
Good. Thank you so much for these amazing questions. Because these questions will also help us dig into areas that I otherwise wouldn't have mentioned today. So, emotional health, that is one of the big aspects of mental well-being. If your emotional health is suffering, everything else will suffer. Your job, your relationships, your family. So we always want to take a closer look into what is causing the emotional distress. From there, we will know exactly what to do. And I'm going to this is just a hypothetical example. It doesn't mean this is what you're currently going through or that's causing your emotional distress. It could be from losing a loved one by maybe they passed on. It could be a divorce. It could be those things. So for example, you went through a divorce. There is just this natural process of grieving that you have to go through. It's only after a year of grieving and you're still suffering the same way, then we term it dysfunctional grieving, and it's a whole new platform. But what you can do immediately to go through that process is to surround yourself with loved ones. Make sure that you're always around the people that send positive energy your way. Whatever hard emotional pain you're going through or distress, you want to surround yourself with people who will empower you, people who will support you, people who will always bring you positive vibes and to help you through. And meditation has always been a key. Where you want to go into contemplative states where you bring in what you want, bring in exactly what it is that you would prefer for your emotional health to be like. What is it that you're aspiring? We all have different needs as far as emotional health. Now, depending on what is causing the emotional distress, you may want to present the thing that you prefer for it to be, and you contemplate on it. It is evidence-based in contemplative science, where you kind of spend time more in the energy of that which you want versus what you don't want. For example, if you're grieving someone, keeping their pictures around or constantly going to their room to take their clothes and look at it and look at all these things might still continue to inflict that distress. So you want to avoid those kinds of things, okay? Especially in the immediate time when you're really, really grieving. Unless you've processed that, you have a better hang of it, and then you can now revisit those items. But most of the time, we want you to avoid the things that would cause further pain or further emotional distress, depending on what the etiology is, meaning where that distress is coming from, the source of your emotional distress. And to get specific, I don't mind getting one-on-one with you to get specific with whatever you're going through. I also do a lot of psychotherapy, which is something that I would recommend if you're really getting dysfunctional, especially when the emotional distress is getting really severe. So you can get to a professional to help you one-on-one and look into it specifically. But because we are here, we will just treat things on a general level. That's what I can say. So if you can sleep and rest and exercise, those things help a lot because they release all these wonderful endorphins into your system that it's calming, and those things will help you a lot, just regulate. So we call them feel good hormones. So if I'm emotionally down and I exercise, it releases the endorphins that makes me feel good. Automatically in that moment, I begin to feel good, and then I tap on that for tomorrow, and then the next day, and then the next. All right. And then for the other question regarding building your immune system, one thing I know that is the most damaging to your immune system is stress. When you're stressed out, you release all this cortisol, and we all know steroids are not good. They break down, tear down everything. They're very damaging to your skin, your body. You gain weight. You have all this visceral fat that just comes as a result of all this steroid. Your sugar goes up because of all this, a lot of damaging effects to your system. Now, when you practice meditation, exercise, and a lot of things are going to surround exercise. You hear anything. Exercise is like the one-stop shop to fix a lot of things physical and mental health related. So when you do a lot of exercising, you just help boost your system with all these good endorphins, which also helps strengthen your core, strengthen your system, and it boosts your immune system. Besides eating certain foods or doing anything, but as far as mental health is concerned, reducing stress is the number one thing you can do to help with your immune system. If you can reduce stress by sleeping, you want to encourage yourself to sleep at a specific time every day. That's called sleep hygiene, where you train yourself, at 9 o'clock, I'm going to bed. So by 8:30, I'm shutting down everything. I'm preparing myself for sleep, keeping the temperature right, getting into comfortable clothing, making sure that I go and, restful sleep. You want to also do the exercise thing. Like I said, it's a one size fit all. It kind of takes care of a lot of things, especially if you're physically able to exercise. You can do a lot of yoga. Yoga helps a lot. It works on all your chakras. It helps release a lot of good just vibes that just strengthens you, protects you. So all those things are really good. And many other things, like I said, because of time, I don't really want to take all your time today, but reducing stress as far as mental health would go a long way to help your immune system.
All right. I hope my queen got some great answers. I hope so. My queen, Jeremy, is asking, what about those work in graveyard shift? By the way, Mike, dear friend, user 26, thank you for being here. I'm glad that you are here. And actually, user 26 also sent greeting to you, Miss Mangela.
Oh, thank you. Thank you very much.
Yeah, so, how would you answer my queen, Jeremy?
Okay. The graveyard shift?
Yes.
All right. So again, thank you for asking. And I know it's going to benefit so many people who also work the night shift. So everybody's reality is unique to them. So when you work night shift, then your day becomes everybody's night, and your night becomes everybody's day. Now, how you manage that is to make sure that whatever routine you have going on is centered around your own timing. Because if you come out of work and you want to be on everybody else's time, then you're going to probably go for 24 hours without sleep. So everybody around you, let your family understand that, I work night shift and my routine and my cycle is different from you. So when I come from work, think about it as that is my night and now I'm going to sleep, even though for you it's your daytime. So please don't expect me to go out to lunch at that time. Don't expect me to go do all the errands at that time. Don't expect me to do things that you would otherwise be doing you will not be doing when you're sleeping, because this is my night. Now, you have to set firm boundaries around that, because if not, you're going to get sucked in. You're going to give somebody a ride from the airport. You're going to go do this. Oh, let me just go to Walmart. Let me just go do this. And you get sucked in with everybody else, functioning with them. But remember, when you were working and being awake, they were sleeping. So don't feel guilty. Don't feel like they're going to think I'm not mindful of, I don't want to spend time with them. But just tell them, hey, if I worked all night, it means that I was awake all night. Now is my time to sleep. And if they truly care about your well-being, they will let you sleep. They will actually encourage you to sleep. They will not assign anything around that. So when you make your schedule, I will give you an example of what I do. I do night shift at times, and what I typically do is I have my routine where when I come back from work, I go straight to sleep. So I get off at 7:30. By 8:30, I'm in bed. That is my night. I sleep maximum is 9 o'clock if I have to stay awake for whatever reason. I go to bed, that is my night, and I wake up at 2 o'clock. Now at 2 o'clock, I was doing intermittent fasting, so it was perfect for me because that's the time when I have to eat. So that's my breakfast automatically. And then I move on to lunch. And then when I'm going to work again, that's my dinner, and I stay up and I come back in the morning. So your reality becomes unique to you. Don't go with everybody else. Otherwise, you will go for 48 hours without sleep. And please don't try that, because it's not compatible with life long term. So just make your own reality the reverse of what everybody else is having. It could feel isolating at times because you'll be going the opposite direction of everybody else.
That is true. That is true. That's why I hate those shifts. But I still work those shifts, though.
Yeah.
But it is what it is.
It is what it is.
Well, let me take a little time to say thank you to every single one of you, huh? And just so you know, Jeremy said, true. Thanks. Kiddos get to you, though.
Yes,
That is very
especially
true.
with the cute little and then but you gotta train them. You gotta train them to know that that is time to sleep, and you'll be amazed. They learn really quick, and they'll protect your sleep time. They'll tell everybody, "Don't call daddy now."
That is true. Huh? Yeah, I want to say thank you to every single person. We're getting closer to the end of this great show today on Go JB. I want to say thank you, first of all, to the people who are subscribing to this platform. Everybody who is a subscriber, thank you to everybody who tap on the screen today. I want you to be seeing me very well. So, thank you who tap on the screen, you who shared the video. Thank you for the love. Thank you for the support. The people who always support this great show on Go JB Health. Let me see. Hola, Doctor Benedicciones, my friend Jorana. How you doing? Thank you for joining. Appreciate you. I always appreciate you. So thank you for being here. Again, guys, you could always share this video. You could continue to tap on the screen, but also you can always become a follower of this platform if you have not done so yet. For my people who are registered for the JB Health Accountability Group, very soon we're coming up. We're gonna get started. I'm hoping in the month coming up we will be able to get this started. I'm very excited because I'll be working with a group of people and help them to improve their health. Josephine, you are very welcome as usual. I'm the one to thank you. I'm the one to say thank you to you, so. But anyway, so before we end this, we're gonna be ending this show very soon. But I wanna make sure that I conclude with Vanetta. The last question that I wanna ask you is how do we contact you, my friend Boston girl? Thank you for the beautiful rose. Appreciate you. Thank you for the gift. I appreciate that. But how do we contact you? Just give them just a quick second. Again, I have to say thank you in the name of everybody who support this show. I want to say thank you for coming by. Thank you for coming by to be part of this great platform. Thank you for coming to share education with us. But in a just quick second, would you tell us how do they contact you? What number? What is your phone number? Or if they have to email you, just tell us very quickly.
So the email address, the best way is my email, vanettamwengela@gmail.com. Facebook is at Vanetta Mwengela, same as IG and TikTok.
All right, guys, I think you guys heard. So thank you once again. Thank you for having you. Willie, you free to go. Thank you, guys. That's how we do it. So we'll see you later. Take care. Take care of yourself. Buston_girl. Yes, I don't know why you didn't get the notification. Thank you for loving my platform. You know how dearly we appreciate you, very dearly. You know that. Tandy, yes, we say it was very educational. I'm glad you enjoy it. So again, once again, I'm glad you enjoy this. But everybody who are here, everybody who were supporting this show today, whether you give us a gift, whether you share the video, whatever you did to make this a great day, we want to thank you. We want to say thank you to you. Thank you to everybody. Thank you to all my queen. to my king, my prince and princess. Thank you for the support today. Again, once again, we appreciate you. Once again, you are very important to us. Was a little bit of a different setup today. Again, we had to do what we have to do to make this happen. No, es una persona. Somebody asked me if that was my wife, but no, that was not my wife. But that was just a colleague. So it's just a mental health provider that we bought on the platform. So we could bring anybody if they have a knowledge they want to share. So we don't have problem sharing. We don't have problem bringing somebody here to share with you. So really, we could bring anybody to this platform. My friend TPKPNGA, thank you. I appreciate you. My dear, thank you. Appreciate you. Me too, my friend. Me too. Appreciate you very, very much. Appreciate you. Well, to every one of you, thank you again for your support to Go JB. We are getting to the end of this show for today. Just remember, tomorrow I'm not gonna be live. It's gonna be Friday, the next time that we'll be live. Again, we're trying to do 3 days a week. It's been very hard for us to be doing it every day. But on Friday, we're going to have a great show. We're going to have a great show on Go JB. We're going to come up with more education. In the meantime, if you have not followed me, follow me everywhere on all the social media platforms, including you could follow me on TikTok so you know whenever I am live the next time. To everybody who shared the video, everybody who liked the video today, again, thank you to you. So thank you, everybody. Thank you, everybody. Thank you for being here. Thank you for the support today. Again, I will see you all on Friday. Once again, continue to support this great platform. Continue to support GoJB. Continue to support me by visiting my pages, giving us likes, giving us shares. Again, everybody, every queen who are here, all my dear queen, I don't think I'm going to have enough time to name every one of you, but my queen Beverly Thomas, my queen Joha. So all these queens who are here today to support me, everybody who really supported us in this platform today, the people who give us beautiful gifts, I appreciate you all. I love you all, and you all have a great day. I will see you all tomorrow. I mean, not tomorrow, but Friday, 2 p.m. Eastern time. Thank you, guys. Thank you for being here for us. You guys are really amazing. You guys are amazing. Thank you once again. We are happy to have such a great group of people to be there to support us, to be there to help us in educating people. So thank you. Thank you, people. Let's see. Yes. Thank you, everybody. So I'll see you all guys later. Thank you. This concludes our great health education show for today. Thank you very much. Thank you to every single one of you who spent this precious time with us. Again, if you're new to this platform, we encourage that you follow us so you know whenever we are live the next time. The show comes on every day, Monday through Friday, 1 p.m. Eastern Time. My name is JB. I'm a family nurse practitioner who believes in educating his people, who believes on supporting his brothers and sisters by sharing his knowledge with them. If you missed the show again, it will be available on our YouTube channel. And if you have not followed us on YouTube, Instagram, or Twitter, we encourage that you do that now. Again, once again, the people who tap on the screen to give us the likes, the people who shared the video, the people who became new followers, those who gave us gifts on this show, the roses. We want to say thank you to every one of you. Thank you to the people who subscribe to this platform. We want to say thank you to every one of you. Thank you for believing that together we could promote health, that together we could educate hundreds of millions of people. I want to say thank you to every one of you. I really appreciate the support that I have all throughout this country, but also even all over the world. We have a lot of people supporting this great project of education. Again, thank you for being here. Until I see you the next time, you stay with great